This segment is sponsored by South Texas Bone and Joint.
Good morning and welcome back to Daytime with Kimberly and Esteban. Well, today we're dropping by South Texas Bone and Joint in the beautiful city of Corpus Christi to speak with fellowship-trained foot and ankle orthopedic surgeon Dr. Christopher G. Larkins. Take a look.
The ankle joint itself is made up of the talus and your shin bone, also called the tibia. And so the space between there is what makes up your ankle. In general, it's covered by a nice surface of cartilage that allows smooth gliding surfaces. However, when you have ankle arthritis, that cartilage breaks down. What that does is cause pain because there's joint space narrowing, there's bony growths that we call osteophytes. You have sclerosis, which is increasing hardening of the bone, like this white increased density on the x-ray. And then you have subchondral cysts that can develop underneath where the cartilage should be. All of these indicate that you have arthritis. In a total ankle replacement, we get rid of all of the bony growths, the spurs on the talus and the tibia, and we replace it with a metal piece on the tibia and the talus, and then we put a plastic piece in between so that your ankle can move. So there's a huge difference in the recovery time between an ankle fusion and an ankle replacement. In ankle fusion, typically you are immobilized for 6 weeks at a minimum, and the reason why is because the bone needs to heal in between there. An ankle replacement, typically 2 weeks you're in a splint post-operatively, and at 2 weeks you come out of the splint into a controlled ankle motion walker or cam walking boot, and you start weight bearing immediately. And that's a huge difference for patients because the ankle replacement, you can get up and moving a lot faster than an ankle fusion. You don't have a lot of bone on the talus or the tibia, and so your cuts have to be so much more precise because there's no room for error. And that is why we always recommend, if somebody's going to do a total ankle replacement, they have to have fellowship training because there's no room for error.
There you have it. Before you consider ankle surgery, speak with Dr. Larkins and his team at South Texas Bone and Joint. For more information on South Texas Bone and Joint, you can visit them at 601 Texan Trail, Suite 300 in Corpus Christi. You can also give them a call at 361-854-0811. Log on to southtexasboneandjoint.com or check them out on Facebook.